effects on human studies. So there's a great graphic from a meta-analysis looking at psychological stress and our mitochondria. And as you can see, the issues with mitochondrial stress, such as the increase in ROS, the circulating cell-free mitochondrial DNA, mutations, and change in the copy number, all had a response to stress. So one study in China looking at over 11,000 women, they found that they had elevated levels of the mitochondrial DNA copy number, as well as increase in mitochondrial DNA mutations associated with depressive symptoms. In a study in the US, they looked at individuals with ACEs, being loss of a parent or childhood maltreatment. And they also found more mitochondrial dysfunction with higher mitochondrial DNA copy number and also a higher basal respiratory load from the mitochondria. This is interesting here too, is that suicide attempters, suicide being acute stress, preceded by a chronic stress that led to this attempt. They took a look at their blood level after a suicide attempt and found they had highly elevated circulating cell-free mitochondrial DNA. Another study looked at women with taking care of children with autism, and they didn't find changes in the mitochondrial content, but they did find that the health index or the quality of the mitochondria suffered. Along this theme, that they found that early life stress was associated with shorter telomeres and higher mitochondrial DNA copy numbers. So how about sleep and our mitochondrial health? What sleep is vital to our mental health, and they took a look at sleep deprivation studies and found that they all had profound impacts on the mitochondrial function. Our brain detox typically occurs during sleep through lymphatic symptoms, where it clears out reactive oxygen species, poorly functioning mitochondria, and clears out other waste products. Another study looked at mitochondrial DNA mutations in rodents and found that they presented with symptoms related to bipolar disorder and also had alterations in their circadian rhythm, and found that these mice responded appropriately to treatments we currently use for bipolar disorder, with improvement in the symptoms with lithium and exacerbation by some antidepressants. Another study looked at that DRP1, which is a protein involved in mitochondrial fission and ATP production. This DRP1 is found to help synchronize our circadian clock with mitochondrial fission and ATP production. And also that mitochondrial fission can impact this protein DRP1, again, demonstrating this bidirectional relationship that one can affect the other. Very important to our sleep, as well as our mitochondrial function, is melatonin. Melatonin is a potent antioxidant. It enhances uptake of pyruvate, stabilizes the mitochondrial membrane, reduces electron leakage, and lowers free radical generation. It also regulates mitochondrial biogenesis, fusion, fission, and mitophagy. And melatonin helps regulate our circadian rhythm, affecting our sleep and feeding patterns, or in other words, our energy demand. And I know I put this on the contributing causes, but again, it's everything. It's kind of that inverse U curve, where this and more studies are out about poor sleep. So how do we regulate sleep and optimize our circadian rhythm? One, we can get early morning sunlight, setting that circadian rhythm, and even some evening sunlight with and before bed. We avoid blue light in the evening and minimize screen time. We should keep a consistent sleep and wake time with some variance in the seasons, and avoid changing time zones too frequently. Related to melatonin and our response to light, similar light production is is looking at red light or near infrared light, where higher blue light can increase ROS and inhibit ATP production, but they found that red light and near infrared light has some therapeutic benefits that typically that you could see at wellness clinics used for hair growth, skin rejuvenation, and just overall well-being. And its mechanism of action is targeted directly at mitochondria, boosting their energy production. So it's making some headways into psychiatry with brain photobiomodulation using this red light to stimulate different areas of the brain, and it has roles in Parkinson's, stroke, and even being looked at for depression. Well, right off the bat, we know that exercise can improve our mitochondria. Exercise can increase the number of mitochondria in cells. It enhances energy uptake and efficiency of mitochondria. Exercise, it can promote mitochondrial biogenesis, improve the overall cellular function and metabolic health. It could also upregulate IGF-1, increasing glucose uptake, giving more energy to our cells and lowering our blood sugar levels. So how does this relate to our mental health? Well, there's a 2005 Duke study that looked at around 150 participants with moderate levels of depression and assigned them to an exercise group, Zoloft or both. The requirements were 30 minutes of activity for 3 days a week of their choice. And after the study found a 60% improvement in depressive symptoms, which was not statistically significant compared to the medication groups. Also, exercise is shown to increase BDNF, increasing our neuroplasticity. Another study looking at resistance exercise training, a meta-analysis in 2018, looked at multiple studies with more than 1,800 participants. There was a mean duration of training of 16 weeks, and they found that resistance training showed a mean effect size of 0.66, which is a moderate improvement in their depressive symptoms. They also did a similar meta-analysis with the resistance exercise training for anxiety, and found a lower but still significant effect in reducing their anxiety symptoms. Another study looking at physical activity and depression was a large study with over 30,000 participants in Europe, aged, I think they're middle-aged, like 60 to 74, I believe, and looked at both men and women using the Euro-D, the European Scale of Depression, with range of 0 to 12, with scores 4 or more being indicative of clinical depression. They found that in both men and women, that vigorous physical activity at least once a week had lower rates of depression, and also found that with increased physical activity more than once a week had further improvements. So should we be prescribing exercise? Could be. If not, again, a lot of these were on like mild to moderate depression, but it could also be used as an adjuvant for severe depression that requires more treatment. Another study looking at exercise and depression. This one basically looked at this enzyme kynurenine aminotransferase, which is seen in upregulated in skeletal muscle with exercise, and shunts this over to kynurenic acid, which is found to be neuroprotective, preventing it from going to quinolinic acid, which has been associated with depressive symptoms. So how about diet? Obviously, our metabolism is related to diet, and there's more coming out in nutritional psychiatry. One study, it was a SMILE study that took participants with already poor diets. They used the Montgomery-Åsberg depressive scale to measure their symptoms. The control used a befriending technique, just with conversations for each week for 7 weeks, while the intervention had 7 sessions of nutritional counseling and mindful eating, which promoted a Mediterranean style diet. And they found after this time that 32% of the intervention achieved remission of their symptoms compared to 8% of the control. What was also interesting is that there was no weight loss seen in either group, meaning that these positive life changes could be seen entirely from the change in quality of food. Another study was a large study performed in Spain and looked at the role of diet preventing future episodes of depression. Over 10,000 participants were included, and they found that Mediterranean diet was protective against future episodes of depression. Some of the diet changes in these studies, like in the SMILE study, they found increased intake of legumes, vegetables, moderate fruit, increase of 1 serving of fish a day. But what stuck out to me is that there was, with like the SMILE study, there was a decrease in 21 servings of ultra processed food. And another study looked called Healthy Life in an Urban Setting, the Helios study. It looked at patients and monitored their depressive symptoms with PHQ-9, and they separated them into 3 groups, being either high sugar, high fat, or high sugar and fat diet. There were around 5,000 patients aged 18 to 70 with an average PHQ score of 5. And they found that with measuring the highest quartile in each group, that the highest in the high sugar and high fat group had the highest odds ratio, or odds of depression, with an odds ratio of 2.36. This effect was not seen in either the high sugar or the high fat group alone. And this harkens back to the authors of the meta-analysis study of how a theory of how the patients with metabolic disorder can seek high energy food sources to relieve stress. And again, is another way how our metabolism may impact our mental health. Another study, comprehensive analysis, looked at ultra processed food and how this affects our mental health, and found an association with ultra processed food intake with a increase in depressive symptoms, with increased intake of ultra processed food, as well as increase in anxiety symptoms. And while I know these are not causal, they are just association. They are large studies and should be taken into account. And why this stands out to me is, I think, as providers, a lot of times we do ask how appetite is, how their energy level is, but really ask how and what they're eating. And so after kind of coming across these studies, I had a patient with anxiety, and when asking diet and appetite, asked, well, what do you eat? What do you typically eat in a day? And she told me that she had a microwave mac and cheese for breakfast and microwave potatoes for lunch. And that was typically what she would eat in a day. With her anxiety symptoms, there was a sensory component there. But yeah, I got her to eat baby carrots. So I felt good about that, at least. So how about an extreme diet change, such as the keto diet? The keto diet is a high fat, moderate protein, and very low carbohydrate diet, essentially replacing carbohydrates with fat, and it leads to elevated ketones, mainly beta hydroxybutyrate and acetoacetate in the body, and decreased glucose levels. All of our cells and organs are able to run off of ketones. And as you can see, it's shunted into the mitochondria with beta oxidation, and it's still able to go through its energetic processes. And there are some theories onto how it can be beneficial, mainly that it can enhance the mitochondrial biogenesis, increase the oxidative efficiency, as well as improve mitochondrial function. It also has theory is the metabolic flexibility with less glucose spikes and running on ketones allows the cells to adapt and benefit from this lower stress response. So how I would compare it is almost like the same engine, but switching to diesel from gas to diesel. So just a different fuel source. So how has the keto diet been used in the past? It does have some evidence in neurodegenerative conditions. Actually, as early as 500 BC, it was known that fasting was neuroprotective and helped in people with epilepsy or seizure disorder. It wasn't until 1921 that a Dr. Wilder, a pediatrician, learned of the keto diet and wanted to implement this, but being a pediatrician knew that growing children have a large energy demand, so he wanted to circumvent just total fasting and try the keto diet to see if it still had benefits, and it did for preventing seizures. A pretty substantial benefit, and was actually the mainstay for several years until around the 1930s when anti-epileptic treatments became more available. It's also been tried in disease like Parkinson's, as well as Alzheimer's, with the keto diet showing less movement disorder, as well as improvement in the non-motor symptoms. Again, kind of harkening back to decreased inflammation, decreased ROS, and just like a smoother energy supply with some benefits in Parkinson's and Alzheimer's. So we can see that the keto diet does have an impact on our nervous system. So how about severe mental illness? And this was a proof of concept study in mice that looked at the P50 gating mechanism. The P50 gating mechanism is an early and frequently studied phenomenon that's seen in patients with schizophrenia or schizophrenia-like symptoms, and it has an underlying genetic basis. So what is the P50 gating deficit? It refers to this phenomenon in which patients are unable to filter early stimuli, such as like auditory clicks, that I would kind of give the analogy of like almost like a reverberation or echo in the brain or the brain cells. And as you can see, how that could contribute to things such as auditory hallucinations. So these researchers wanted to take a look at the ketone diet, and they placed these mice on the ketone diet for 3 weeks. They then measured their level of ketosis and implemented this test with the repeated auditory clicks. And they found that in the high ketosis group, that the cells in the hippocampus showed the proper level of inhibition with the test amplitude compared to the condition of 0.17 with a ratio of 0.5 or less as evidence of the normal sensory inhibition. And they did find a dose effect that higher levels of ketosis did have a higher or lower level of response, indicating the proper inhibition. Much improved compared to the normal diet or high carbohydrate group. So how about the ketone diet in practice? Well, in 1965, the ketogenic diet was used on an inpatient unit for 4 weeks and with patients with schizophrenia, and the clinicians did note a decrease in their symptoms after a couple of weeks. There are case studies of looking at patients with schizoaffective disorder and schizophrenia. I think it was 2 twins with schizoaffective disorder that underwent the diet and did noticed some improvement in their psychotic symptoms and improvement and negative symptoms as well. What I found interesting in 2009, that there was a 7-year-old woman who had chronic schizophrenia since her teens, and she started a ketogenic diet for weight loss. And she noted that just within 8 days that she had no hallucinations, and even after a year remained free of hallucinations and lost some weight. A physician who had interest in the ketogenic diet actually followed up with this lady 12 years later and found that she remained free of hallucinations, that she was off of her psychotropic medications. She was functioning independently, and better functioning society. And she had also lost a significant amount of weight. And why I found this interesting, not that I think that the keto diet is like the new best thing for schizophrenia or schizophrenic symptoms. I wanted to take a look at more of how this could have impacted her, this radical change, because that's what a ketone diet requires. To undergo a keto diet requires a great amount of discipline, because there are no cheat days. If a person has a cheat day, it'll break ketosis and they lose all the benefits of this. So if she was disciplined enough to follow a ketogenic diet, what was the spillover effect? Did she start other lifestyle changes, such as increasing her exercise, getting out and socializing more, following better sleep pattern, getting better sleep, and also it kind of indicates like how metabolically unfit was she before. I mean, if she lost 150 pounds, there must have been some degree of metabolic syndrome there. And so this lady undergoing a radical change in diet and lifestyle may show that there's benefit to our metabolism and its impact on mental health.